that are best for themselves and their families. Although following the federal mandate has been paused here, it is not over. The Georgia injunction is still working its way through our court system. And to the over 400 people who've called and emailed my office, and to the many people who marched to City Hall, took the time to register to speak, or wrote a comment for today's meeting, stay vigilant. The fight is not over, as my fellow councilmen have discussed here today. I will continue to support our police, continue to support our firefighters, and I will continue to support all employees at the City of Phoenix. Thank you, Mayor.
Thank you, Councilwoman. Councilwoman Ansari.
Thank you, Mayor. People rightly have about staffing shortages and all of that. We haven't really seen the vaccine mandates impact that in a huge way. I know Councilman Waring talked about New York. As of November 10th, New York is at 93% compliance. And again, that was largely after the city and the unions were quite worried that they would lose a third of their police officers. They're now at 93% compliance overall and about 86% for the police department. Also in our own state of Arizona, Tucson had a mandate and the city is now seeing 99% compliance. So just again, when it comes to kind of fear mongering around this issue, I think it's important to look at other examples and recognize that it's not at all been the way that some folks have said that it could end up being. We've actually seen very good results from the vaccine mandates when they've taken place, and I think it's benefited public health. But ultimately, just hope that people will do everything they can to support our community and public health. Thank you.
Mayor, could I ask a question?
We'll go to Councilman O'Brien and then Councilman Waring.
Thank you so much. And I appreciate Councilwoman Ansari's sharing the experiences of some of the other cities. I do think that there is something unique about the city of Phoenix. And Jeff or Lori, could you share with us how many police officers or firefighters are eligible for retirement?
Mayor, Councilwoman O'Brien, members of the council, I don't have that exact figure with me. We do have a high percentage of our firefighters and police officers eligible to retire in the next 5 years. It is approximately 15% of our city as a whole over the next 5 years. But I can get that information for you that's more exact.
Okay, and just as and I think an explanation, or if you could help us understand, we had a gap in hiring in those departments, especially the police department during the Great Recession. Is that correct?
Councilwoman O'Brien, Mayor, members of the council, yes, we actually during the Great Recession, starting in October 2010 and between then and March of 2015, we actually did not hire police and firefighters because we were going through a rebalancing of our 3 dedicated public safety funds. And that plan was put into place after looking at several different options to bring those funds into balance. The plan that was ultimately adopted and agreed to by council and labor and management was one that would balance those funds through attrition, which meant that we had to wait for folks to leave rather than laying police officers and firefighters off to balance out those funds. So yes, there was essentially about 5 years where we went without hiring.
Okay, so we went. Sorry, you said how many years?
Approximately 5 years. It was October 2010 to March of 2015 when we started hiring police officers again. Firefighters, we actually started hiring a little bit before that because we were able to balance their funds earlier.
Okay, so appreciate it. And you said, Lori, 15% over the next 5 years. And how big is our force, our police officers?
We have approximately 3,000 police officers or members of our police department that are sworn. We have 3,125 sworn positions that are available to be filled. Approximately 2,750 are filled at this point in time. I think I have that.
Okay. Thank you so much, Mayor and Jeff and Lori.
Councilman Waring.
Yes, Mayor, thank you. So the New York example. New York and Phoenix, first, aren't really the same thing. Obviously, they're a lot bigger than us. If they lose 30 officers to retirement, it affects them differently than it affects us. We can't replace the ones who are retiring now, and that's 1% of our entire force. Actually more, because I think we've dipped below 3,000, and it's probably a minuscule number of officers as a percentage in New York City. I wonder if New York has such a high percentage of potential retirees in its police force. So I don't think any of that's fear-mongering. My understanding is also that New York was pretty liberal in its use of medical and religious exemptions. So if you have a medical religious exemption, you're not actually vaccinated, and it's like none of this ever happened. It's just shuffling around paperwork, and you gussied up the numbers to make everything look good on paper. I have also noticed that, this council, I know Chris said there might be some legalities, but it just seems like there was no real push to put a mandate into effect if the council was just left to its own devices. Then the federal government did it, and then now it didn't because of the stay. But I heard some things there that sounded like this is a wonderful idea, but I noticed we didn't try to put it into practice like Tucson did. So there may be some disconnect there. I don't know. But again, I would be cautious saying that New York is like Phoenix, and New York still isn't in compliance if compliance is defined by 100%. So I guess from one perspective, perhaps they made progress, assuming sacrificing 30 officers is considered progress. Maybe they had them to sacrifice. I don't know. But I do know we don't. And that's not fear-mongering. That's just common sense. Thank you, Mayor.
Thank you, Councilman. A few questions from me. Do any of our city employees or departments have specific vaccines in order to be hired or to do the job?
Yes, Mayor. The fire department currently has vaccine requirements for firefighters.
I'm sorry, I can't hear you.
Apologize, Mayor. Fire department currently has vaccine requirements for firefighters.
And how many firefighters have refused to get vaccinated?
I don't have that number with me right now, Mayor, but I can reach out to the fire department and respond to you with that.
Okay. Lori, do you have any recollection of how many firefighters at hiring expressed concern
Mayor,
about Hep A, Hep B?
Mayor, I don't have an exact figure for you, but I can tell you that it's not an issue that's ever been raised to my attention.
Thank you. I think that is important to protect the safety of our community and our firefighters. They do get a series of vaccinations. They are out there doing healthcare work, which we very much appreciate. It protects them and protects our community. I want to thank everyone who testified today, including people who shared very personal stories. Thank you to our healthcare leaders. We had people who are responsible for the care of so many in our community share what is happening on the ground in Phoenix at our hospitals and other medical centers right now. I thought it was particularly powerful to hear that we have hospitals that are busier now than they were at this time last year when the vaccine was not available. COVID is still very much impacting our community every day. We have 49 firefighters out right now on COVID leave. That means there are some ambulances that cannot respond when we want them to. I think the Tucson example is relevant. So Tucson had 91% compliance with vaccination, and when you look at medical and religious exemptions, they got to 99%. They had one firefighter and one police officer who did not comply. So we really need to look at what is happening in our communities right now. The vaccine is overwhelmingly effective. People who pass away are 20 times more likely to be unvaccinated. I thought Dr. White's testimony was very important to this conversation. He mentioned that people with natural immunity to COVID-19 are 5 times more likely to get COVID again than people with the vaccine. Nothing is perfect, but the vaccines are the best tool we have according to our healthcare leaders. If we want to look at public opinion polling, it says the same thing. 73% of Americans believe that vaccines are our best tool to get out of COVID-19 and to manage this in our community. Thank you to Kristen Arquiza and the people who shared personal stories about losses. 22,000 people in our state who we've lost. And at the city level, 24 employees. If there was something we could do in any other situation to save the lives of 24 employees, I'm confident that we would do it. The funerals have been heartbreaking. They sound like incredible people and family members. And you see their kids, picture them with their kids where they used to get wonderful hugs or be at Comic-Con or Disneyland. But unfortunately, not a lot of pictures at graduation. And I want the children of our city employees to have their parents at graduation. This is a tool that will help us do that. Too many empty seats. So I would encourage people to get out and get vaccinated. If you've already been vaccinated, please turn in your card. This is the best tool we have right now, and it is incredibly important. Thank you to everyone who shared very difficult and personal testimony. These are emotional and difficult conversations for many, but the science is clear behind the vaccination. Any additional comments or questions from council members? We are adjourned. Thank you all who participated today.
The emotional and personal